Hello, everybody. This is Dr. Langdon, mother to 6 adult children now and 2 grandkids, but almost 3. If I've been confusing you lately, it's about to be born any minute now, so almost 3 grandchildren. Today's video is from my new perspective. I recently made a video about studying tips for med students, and certainly I lived through that era as well. But now that I'm teaching at a medical school, I have the honor and responsibility to write exam questions. So I would just like to chat with you guys a bit about how we tried to go about that, and perhaps it'll help you as you think about answering those questions on exams. I have done the webinar for the National Board of Medical Examiners, NBME, as well as NBOME, National Board of Osteopathic Medical Examiners, because I am allopathically trained. I'm an MD, but I'm currently chair of peds at an osteopathic school. So if you are not aware, the MD students take the board exam called USMLE, United States Medical Licensing Exam, and the DO students take the COMLEX, College of Osteopathic Medicine exam, level exam. And so there's this, it's very, very similar in that there's one that's taken after the second year. There's the next one, you call them steps in USMLE, and you call them levels in COMLEX. You take first level after second year, and then the second step level after third year, and then the final or third after your internship, generally in your residency. So some of the very same principles that were taught in these groups are applied to how we write exams, even in your regular med school exams. Now, remember that this could be different for a quiz. A lot of times for a quiz, I will phrase the question more simply, and there's just one straightforward answer. But let me explain the average board question. First of all, this is different than when I took boards. I can remember that we could have the best answer to the question could be a false. All of the following are true except, and you had to pick the one false answer. We are now taught not to phrase it that way, that the right answer should be the best answer in a positive sense, if you understand what I'm saying. The best true answer, never a false answer. We don't do true false anymore. We do all multiple choice, usually 5 choices. Sometimes it will be 4. And they are supposed to be in alphabetical order, and they are supposed to be all of the same category. So in other words, it could even help you to know this. If you glance at that question first, I want you to see what's just the big picture categories of all the answers. Are all the answers imaging options? An X-ray, an MRI, a CT scan, whatever. Are all of the answers laboratory test? Liver function, comprehensive metabolic panel, complete blood count, whatever. Are all of the answers the diagnosis, and you have to choose between those? Or, so you understand what I'm saying? Just get a quick glance and get big picture. What are the categories of my answers as I'm reading this question? Now, understand, we have been instructed to make this a very clear clinical scenario. That is, this should be a question that could actually happen in real life. Maybe we've seen it or heard of it, or it would make perfect sense if it did happen. Now, to do that, though, you are going to get some background details that may not have a giant impact in the answer to the question. So if I were writing a question about maybe something about a sick neonate, I'm going to say, as we would say in rounds on a baby boy Smith is the 3,600 gram product of a 39-week gestation, born to a 23-year-old G1P1 mom who presents to special care nursery with difficulty breathing, or whatever. I have to give some of the background, and it doesn't mean all the tiny details of the background matter. Now, sometimes they will. If it was a premature infant and they had respiratory distress syndrome, that would make sense. Or if it was a huge infant with meconium-stained fluids, obviously, you'd be more worried about meconium aspiration syndrome or something like that. We will try to give you the relevant clues, but there may be additional clues that don't really impact your decision. Now, here's the part that's tricky to write the question, and certainly tricky for you guys to take. A lot of times we're trying to give you all the details to help you make the diagnosis, right? So for that example, that wasn't a great example, but say I had written the question so that the answer was supposed to be transient tachypnea of the newborn. It was a full-term baby, with some fluid in their fissures on chest x-ray or whatever. I gave you all the classic findings of whatever we were talking about. And you figured out, oh, she's talking about transient tachypnea of the newborn, TTMB. Yay, I've got the answer. But then that's not what the answers are, right? Then the answers are going to be something like, what's the next best step? And I know that's frustrating for you guys. So typically we think of board or exam questions as 2 steps. You have to figure out the answer of the diagnosis, and then by knowing that, say what's the next best step, or what's the next lab draw, or what's the next imaging study, or whatever it may be. I know that's tricky. I want to tell you a few things though. We are always instructed to not intentionally write the question to trick you. That is not our goal. Our goal is this, that if you have studied adequately and you know your information, you'll be able to get the right answer. Our goal is also that you won't just get the right answer because you're a good test taker. Right? And our goal is also that you won't fail if you really know your stuff just because we did a poor job wording the question. So one thing that is brand new to me in medical education, I've only been doing this for about 2 years exactly, is that now students these days can challenge exam questions. And that took some getting used to, because back in my day, I just felt like an idiot because I missed it and we just kept rolling. But now a student could say, this question was worded in a strange way, and I don't think it was taught that way in lecture or explained to us clearly for us to understand the right answer. And so we will go back. I hope y'all know we'll go back and look at that lecture. Now, sometimes that happens, and I very obviously clearly stated what I was going to test you on and gave you the exact right answer. Direct quote of what I asked in the exam questions. So you're not going to get those challenges. But if it's a really good challenge and it was worded poorly, sometimes you will get those challenges. So know that we hate it when we lose a challenge. We don't want it to be confusing. That means we failed. We want you to understand it. And if you studied properly and know your stuff, you get it without being tripped up. Nobody's trying to trip up. I even try, even in the lecture, to really make it clear the points that are important, not only for the exam questions I may have written, but for your ultimate board exam questions later. Also, I would caution you to be careful about pathognomonic versus most common. For example, trisomy 21 babies, their pathognomonic congenital heart lesion is AVSD, endocardial cushion defect, but the most common is VSD. So anytime you hear most common, it's usually going to be VSD, to be honest. That's a little trick there. But know that that's a different thing, most common versus pathognomonic. Pathognomonic meaning that if you find this, you almost always have this other underlying syndrome or condition. So be very careful how the question's worded. Again, not usually intended to trip you up. We're just really trying to ask you a legitimate question. Which one defines this syndrome? Which one's the most common with this syndrome? So I hope you know that we are bound by a lot of rules, keeping it specific, keeping it clinically relevant scenario, no false questions, only the best, multiple choice only, in a positive light, in alphabetical order. So those are all the tricks I know. And even then, even when I know how to do this, it can be very tricky to ask the question in a way that tests you appropriately. So we're trying. This field of study is getting better and better. And thanks to all modern technology and analytics, we're better able to see which questions students do well with if they understand the material, which ones are obvious or too easy, or anybody could get the right answer just because they were a good test taker, and which ones trip students up even if they knew the material. We never want to do that. So I hope this helps you guys. Thanks.